today's lecture is the stage before become cancer. So this is when that guy has cancer at the time, and the result of this cancer is hemimandibulectomy, total prostatectomy, and also remove all the cervical lymph nodes. So you can see the problem is very bad. So we wish to diagnose lesion before it become cancer, and this is today's lecture. Okay. So we focus on leukoplakia and erythroplakia because erythroplakia is the most widely recognized or oral potentially malignant disorder. Whereas erythroplakia, even though it's rare, it has high risk to develop cancer. Okay, so oral leukoplakia, leuko is mean white, plakia is mean patch. Okay, so leukoplakia is mean white patch. And it cannot be, it has risk to develop cancer. Once we will diagnose oral leukoplakia, when it cannot be other lesion. So we have to exclude other known diseases, then we can diagnose leukoplakia. For example, like this one is a 40-year-old female. You can see at the both buccal mucosa is present like this. So do you think this patient has leukoplakia?ตอบแล้วเดี๋ยวจะได้ให้คะแนนเนาะไม่มีใครมีสอบประการอะไรไหมใครยกมือตอบว่าอันนี้เป็นอะไรเพราะอะไรมันมีสองแล้วกันโอเคขอบคุณค่ะชาเตือโอเค what is this disease ยกมือตอบเลย okay and I told you that leukoplakia is re-diagnosed by exclude other known lesion. So what about this one? Is it leukoplakia? เรียนไปแล้ว
I think it could be a lichen planus.
Because
It has the white lesion patch that is similar to this picture, like the web-like pattern on
the white striation, and what else? You know, what else? That you think is the reason behind cancer? The answer is correct. Okay, so it's not leukoplakia because it is lichen planus. It presents the typical characteristic is a white striation on bilateral buccal mucosa, present in female about middle age. Okay, so everything is consistent with oral lichen planus. เป็นที่เท่าไหร่คะ Okay, so what about this one? ต้องยกมือสูงๆเพราะว่าเดี๋ยวขอโทษนะคะดูว่าที่ของหนูอะค่ะทีหลังหนูยกสูงๆแล้วก็บอกเลขที่เนาะเพราะยังจำนักเรียนไม่ได้
No, it looks like linear alba.
Because how do you think is this in your album?
Because it's a big white line on the buccal mucosa.
And what else? That is the same reason to lichen already.
It looks like that.
อธิบายให้ได้ค่ะ เพราะว่าอะไรเอ่ย มันก็ไว้ลายเหมือนกันแต่อันนี้มันยังไงคะเป็นเนาะเป็นสเตทไม่ได้เป็นแพทไม่ใช่ค่ะ
เพราะว่ามันอยู่ตรงฟันหรือเปล่า The position ตรง occlusal
Then it's present on the buccal mucosa correspond to occlusal line เลขที่อะไรคะ
015 ค่ะ
015ก่อนหน้า0อะไรที่ตอบลิเนียว่า0อะไรฮะไม่ตอบเหมือนกันฮะ001 Okay, so this one is linear alpha. Listen and horizontal white line. So when you want to diagnose leukoplakia, you got to know some oral white lesion, and at least these 8 lesions you should exclude. Okay, so like lichen planus, linear alba. What about this one? It's not leukoplakia. On this one is aspirin burn. So the patient told you that he has a toothache and he put aspirin tablet on the buccal mucosa, and later on all the buccal mucosa turned white like this. This one the patient report that the patient used tooth whitening solution and it's burned, so it's not leukoplakia, and you know that when you taking a patient history. Okay, so that is in the group of chemical injury. It may be other things. Aspirin burn is one of them. And okay, so start with taking a patient history. Okay, and then do a clinical examination. Okay, this table summarize from I took from the oral oncology. It's quite old, but it gives you the idea that you before you make a diagnosis of leukoplakia, you have to start with exclude common white lesion like linear alba, and the main diagnostic criteria is the clinical aspect that it presents on the line of occlusion in the cheek mucosa. If it's aspirin burn, the patient have history of local application of aspirin tablets. Okay, that is the idea. So you can use other article as well, but it's something similar to this. Okay, so the etiology of leukoplakia is tobacco, either smoke or not smoke, and also better quick use. More than 80% of patients with oral leukoplakia are smokers. And heavier smokers have more numerous leukoplakia and larger lesion than light smokers. And this to confirm that tobacco use is really the cause of leukoplakia. This patient has white patch in the vestibule in this area because he put a tobacco product on this area. Just he stopped using that for 2 weeks, it turned to be normal. So tobacco use and better quick use is the cause of oral leukoplakia, the one that has been proved. And also you can see the use of better quit in Thailand former times, in Taiwan nowadays, and also in Nepal, Pakistan, something in the most of drivers use this kind of product to keep them awake. Okay, alcohol, although it's not shown or proof that is the cause of leukoplakia, but there might be some synergistic effect between alcohol and tobacco. And even though we do not have proof yet, we do not recommend patients to use mouth rinse containing high alcohol. And this is another herb product which has been pushed in the toothpaste or mouth rinse. This misspell. Okay, but I checked it's not in Thailand. Okay. Ultraviolet radiation. Okay, so normal people do not sensitive to UV, but in immunocompromised person, it may be sensitive to UV and maybe the cause of leukoplakia, particularly on the lower lip. And microorganisms like Candida albicans. Candida albicans cause candidal leukoplakia or chronic hypoplastic candidiasis. It's not leukoplakia, but we think that it may be the cause in some cases of leukoplakia, but it just not show typical feature of candidal leukoplakia. Human papilloma virus, EBV, or Treponema pallidum in syphilis. In secondary syphilis, the patient have white patch like this one. So it's not leukoplakia, but scientists postulated that it may be the cause of leukoplakia, some leukoplakia. Okay, similar to chronic trauma or irritation, like if you see a patient with white patch on the buccal mucosa, and the patient report that he or she has a cheek biting habit or white patch on the lateral border of the tongue, and the patient have tongue biting habit. So these are not leukoplakia. They are morticaceous buccarum or morticaceous lingurum. Okay, but in some case, they believe that trauma or irritation may be the cause of leukoplakia. But if we can prove that is related to irritation, it's not leukoplakia. Okay? Okay, the age of patient usually older than 40 years, prevalence increase with age. It has strong predilection for male, particularly when male smoke more than female. And the common size are the buccal mucosa, but some population may report other locations. So this is depending on population that they study. And clinical features can be divided into homogeneous or non-homogeneous. Okay, so if it's homogeneous, it has white, uniformly white and smooth or wrinkled surface. This one is homogeneous thin leukoplakia. So this one, so you can see a little bit wrinkled, but it's homogeneous or uniformly wrinkled. This one is also homogeneous, a thick leukoplakia. In the non-homogeneous group, it may have specific terms like speckled leukoplakia or verrucous leukoplakia. This one is called speckled leukoplakia or erythroleukoplakia. So you can see a white area and red area. So mix of white and red lesion. This one as well. So this one is called speckled leukoplakia. This one is called verrucous leukoplakia. So you can see it's produce a mass with verrucous surface like a cauliflower. This one just called non-homogeneous because it's thick here and thin here. Okay, a little bit red in the upper, the back. Okay, so this one just called non-homogeneous leukoplakia. Okay, what about the histopathologic features of leukoplakia? It can be grouped into keratosis or dysplasia. Keratosis means there is a thickening of cell in the keratinized layer. So you can see this one is normal and this one is hyperkeratosis. Hyperkeratosis or keratosis is the same thing, okay? So many times that hyperkeratosis occur together with acanthosis. Okay, so this one, acanthosis means there is increase in number of glial cell. Okay, so this is normal. There is no acanthosis here. This one has acanthosis. So you can see in the epithelium with acanthosis, the rhetoric is a broad red type. Okay, so this is how it looks. It's normal, it's large here and pointed at the end in broad base rhetoric, which indicate acanthosis. Is the rhetorics are quite equal inside at the base and at the point. Okay, the second characteristic, the second histopathologic features of leukoplakia is dysplasia. So dysplasia is the state here before become oral cancer, oral squamous cell carcinoma. So you can see oral squamous cell carcinoma proliferate and invade into the underlying connective tissue, whereas dysplasia, the cell chain, but it's not invade into the underlying connective tissue. Okay, this is squamous cell carcinoma. So you can see from this area to this area is connective tissue. So this area, this orange line indicate epithelium border. So you can see many epithelium proliferate into the underlying connective tissue. So this one is squamous cell carcinoma. เรียนหรือยัง squamous cell carcinoma เรียนยังคะ เรียนแล้วเนาะ Okay, so this is normal. This is dysplasia cell chain, and this is oral cancer. It chain and also invade into the underlying connective tissue. So in histopathology is categorize characteristic of epithelial dysplasia into changes in the architecture or changes in the cytology. In the architecture, like drop shape rhetoric, loss of plurality of basal cell, or irregular stratification, or mitotic activities high in the epithelium. If cytology change is like nuclear pleomorphism, what is the meaning of nuclear pleomorphism? Or cellular pleomorphism? ตอบได้ไหมคะ ยังไม่ได้อะไม่ยังแต่ยังไม่ใช่แปลก
Like there is a change of shape and size of nucleus.
ยังไม่ใช่เอานิวเคลียร์ pleomorphism มาก็ได้ So compare between many cells, they have นะอันนั้นคือ pleomorphism เนาะอ่ะไม่กี่นะคะ Okay, that is the meaning of nuclear pleomorphism. So variation among the cell, variation of nuclear shape and size or nuclear intensity. And cellular pleomorphism is cell cytoplasm, the chain of shape of the cell, something like that. Between many cells, like in this group, everybody look different. That is pleomorphism. Okay, and also increased nuclear cytoplasmic ratio and single cell keratinization. And this one is example of mitotic in the maturing cell. So if in normal situation, if you see mitotic figure, it should be in the
Basal.
The basal layer.
yes, the basal layer. But this one you see it in the which layer?
Prickles.
The prickle cell layer.
อะไรนะ
Prickle cell layer.
อ๋อโอเคเลขที่เท่าไหร่คะ
016.
Okay, so if it's not in the basal layer, it's wrong. Because in normal situation, only basal cell can have mitotic. Basal cell divided into daughter cell. Daughter cell stay in the basal layer for a while and then move forward, upward to the prickle cell and again move forward to the keratinized layer to become keratinized cell and produce keratin. Okay, that is normal situation. So in case you see mitotic figure in the prickle cell, it's wrong. Okay, so this is mitosis in maturing cell. Also, another thing wrong in this photo. What is it? ได้แต่ว่า จะเอาอยู่แถวไมโตติก แถวไมโตติกมีอะไรผิดปกติอีกอย่างหนึงอะไรนะ ไม่เอาในแง่ของไมโตติกอะค่ะ รูปเนี้ย atypical เป็นอีกรูปหนึ่งรูปนี้ต้องการจะบอกอีกอย่างหนึ่ง atypical เป็นอีกรูป
broad base rendering
เอาไมโตติกก่อนยังไม่ไปถึงตรงนั้น acanthosis ตอนนี้เรากำลัง now we are talking about dysplasia so acanthosis is not a characteristic of dysplasia okay that is in the category of hypokeratosis with acanthosis
อะไรนะ increase nuclear cytoplasm ratio
มีไหมมีใครตอบอีกไหม
increase the nuclear cytoplasm ratio
เอาเรื่องไมโตติกเรียนเอาเรื่องไมโตติกหมดแล้วเนาะ
this keratotic cell
ยัง
เหมือน
เฉลยแล้วล่ะ
increase numbers of mitochondria
yes increase number of mitotic นี่ไงเนาะ so you can see in one snapshot if you see many mitotic figures it means there is an increase in mitotic figures otherwise it's very difficult to find one mitotic figure already in one snapshot okay so this one you can see mitotic figure here another one here so the first dysplasia the first characteristic of dysplasia in this photo is mitosis in maturing cell second is increased number of mitotic figures so you see one here one here one here one here มีใครเห็นที่อื่นอีกไหมมีไมโตติกที่อื่นอีกเปล่ามาชี้เลยจะได้ไม่หลับจันก็จะหลับก็จัน
อันนี้
เดียวเก่งมากชื่อเลขที่อะไรคะสายนักเรียนอย่าคิดว่าจันไม่ได้ให้คะแนนนะปีที่แล้วอ่ะมีคนตกเจนแพดนะแต่ว่าเอาไอ้เนี่ยไปบวกให้นักเรียนจะคิดว่านักเรียนถ้านักเรียนได้ C นักเรียนอาจจะเป็นหนึ่งในคนที่ผ่านมาเพราะคะแนนพวกนี้นะ Okay, this one show atypical mitotic figures in the prickle cell here. Okay, so if it's normal mitotic, it may present as prophase like this one or this one, metaphase, anaphase, and telophase. So this one doesn't look like any mitotic figure present here. This is normal mitotic figure. So this is atypical mitotic figures. So in any lag is wrong. Okay, but this one is double wrong because it's also present in the prickle cell lag as well. And keratinization in the prickle cell, a group of prickle cell here produce keratin. So this is premature keratinization. So if it reach the keratinized lag, then it should start to produce keratin. If you produce keratin in the prickle cell is wrong. One of the characteristics of dysplasia. And this one show you this keratotic cell, which means individual cell produce keratin. So you can see the color of keratin inside the cytoplasm. So this one is not group. Okay, we call this kind of cell as this keratotic cell. This one show you loss of basal cell polarity. This is figure B. So in normal, the upper one is normal. So you can see basal cell in the normal epithelium. It has a palisading a little bit, palisading arrangement. But in dysplasia, basal cell loss of basal cell polarity. We can call this one as irregular stratification because the upper cell layer also not really in order, just slightly. Okay, so this one is loss of basal cell polarity. Okay, And this one show you increased nuclear cytoplasmic ratio and nuclear hyperchromatism, nuclear pleomorphism. You can see when we talking about nuclear pleomorphism, you have to compare many cells together. This one show you drop shape rhetoric. So this one is drop shape rhetoric compared to normal. Okay, normal is look like this. Drop shape rhetoric is the opposite. In some textbook, it's may call teardrop rhetoric as well. So in case you see in the national writing exam, it's the same thing. Okay. And another one is the verrucous or papillary characteristic. So you can see this is papillary, and this is the verrucous. This one is not papillary and not verrucous. So you can see, you can compare between them. Okay. And this one show you that this area had dysplasia and is normal again, and dysplasia again. This is called multifocal or skip lesions. Okay, unfortunately, there are no accepted definition of individual feature of dysplasia. And so, for a long time, we used two characteristics to tell that epithelium has dysplasia or not. If you have characteristics that we described before, two of them, then we say this epithelium has dysplasia. Except for the verrucous surface in the WHO 2022, it has been stated that verrucous or papillary architecture, only one characteristic we can call that epithelium has dysplasia. Okay. Once we classify that epithelium has dysplasia, then we have to grade it. We have two grading system, but we use this one, the T-title grade, which divide the grade into mild, moderate, and severe. And using the thickness of the epithelium divided into three parts. If all the chain are limited to the lower 1/3, it's categorized as mild dysplasia. If it's extend to the middle third, it's called moderate dysplasia, and higher than extend to the upper third is called severe dysplasia. So this one show you mild dysplasia. Any characteristic you can pick out here? No. Yes. Can you show me? Can you describe? Vary from which one? Vary from another one. That one is inflammatory cell.อันเนี้ยสีเข้มเห็นไหม This one on the right, the nucleus quite hyperchromatic, where the left one is not so hyperchromatic. That is one thing, nuclear pleomorphism. Okay, เมื่อกี้อะไรคะสี Also, there is nuclear hyperchromatism in this photo as well, but every chain are limited to the lower 1/3. This one is moderate dysplasia. You can see chain high to the middle third of the epithelium. You can see large nuclear here, and also hyperchromatism. This one is severe epithelial dysplasia. Anyone want to describe? So you can see the chain from lower the basal layer to nearly the keratinized layer. So this is more than 2/3. Okay, so this one is severe dysplasia. Any this plastic chain you can pick out? Alena? เรียกตามที่ในตารางสิคะเรียกตามในตารางเนาะเวลา describe เอาในตารางเนาะ
this keratotic cell
yes
premature keratinization
ชี้ได้ไหม
this keratotic cell แปลว่ามีอ่ะ
เอา loss of basal cell polarity มี premature keratinization ต้องอะไรมีอีกไหม อันนี้มี loss of basal cell polarity มี premature keratinization มีเนาะตะกี้นี่จาไม่ได้พูดเนาะ โอเคค่ะ มีเนาะ เวลาที่เซลล์มัน loss of cohesion ตะกี้ลืมพูด เนี่ยค่ะ อันนี้ไม่มี loss of cohesion อันนี้มี loss of cohesion between cell เนาะ นี่ก็เป็น loss of epithelial cell cohesion ก็เป็น one of the characteristic of epithelial dysplasia เลขที่
อันแรกที่เขาพูดคืออะไร
โอเคนะ that is roughly the idea okay
Loss
so
of
this one I just want to show you
basal
that
cell
sometimes even though atypia is seen in confined to the lower one third but if there is a lot of pleomorphism we might upgrade it into moderate or severe dysplasia so it's quite a very subjective okay and also another term is called carcinoma in situ. Carcinoma in situ is means severe epithelial dysplasia from basal layer to the top. So other words is the whole thickness of the epithelium show epithelial dysplasia. And so this is carcinoma in situ. So you can see this is carcinoma in situ. The last WHO, the latest WHO have stated that carcinoma in situ is not recommended to use in the oral cavity. So in the oral cavity, carcinoma in situ is similar to severe epithelial dysplasia. So this is the latest WHO classification. But the problem is that in the national license, it may be not follow the WHO yet. So you might see this term in the national license. So it means the whole thickness of the epithelium has severe dysplasia. But if you look at the choice, it is the multiple choice, so you should be able to see. Sometimes it may use the latest WHO classification. Okay, that is the histopathologic features of epithelial dysplasia. So when we really have patient with white patch like this one, so we exclude any other white lesion out and we think is leukoplakia. So this one is called clinical diagnosis or provisional diagnosis. Once you biopsy, you take the biopsy, maybe the incisional type, so most of the time it's incisional type. So you remove some of them and submit it for histopathologic examination. And the histopathologic feature come out to be squamous cell carcinoma. So the definite diagnosis of this disease is, so imagine on the first day, the patient come and what are you going to tell the patient before you make a biopsy? เราอยู่ได้ถึงกี่โมงถึงกี่โมงบ้าง3 โมงโอเคค่ะรีบไปนิดนึงนะ Okay, so you took a biopsy. Then the biopsy and pathologist read this slide, this specimen for you and say it is squamous cell carcinoma. when the patient come, what are you going to tell the patient? She has she already has cancer. Okay, so that is how it's work. Okay, so we have provisional diagnosis, then we do a biopsy, then we have histopathologic features, and we have definite diagnosis. So when the histopathologic features come out to be keratosis or dysplasia, then when the patient come back to see the result of the specimen, then you will tell the patient that the patient have the patient do not know leukopenia. The patient have, okay, imagine that จะบอกว่าอะไรอ่ะคนนี้ตะกี้บอกถูกไปแล้วอ่ะคราวนี้จะบอกคนไข้ว่าอะไรคะตะกี้นี้บอกคนไข้คนแรกว่า have chance to develop cancer but it turned out to be cancer already เนาะหลังจากนั้นจะทำยังไงก็ไปรักษากับ cancer คราวนี้ถ้าเป็น keratosis หรือ dysplasia then this patient have leukopenia ดังนั้นเราก็จะบอกคำเดิมที่เราเคยบอก so oral leukopenia is a clinical term. We do not have histopathologic feature for leukopenia, and for a predominantly white lesion that cannot be characterized as any definable lesion clinically and histopathologically. Okay, so it's still a exclusion criteria. Okay, so it should not be in any other known disease. So pathologists will not report you that this case is leukopenia. Pathologists will read it as keratosis or dysplasia. Okay? เข้าใจไหมคะ Okay, so this is how we manage white patch. So if we exclude other definable lesion, then at this day we will have provisional diagnosis of this lesion as leukopenia. If it has possible causes, so we eliminate the cause and observe for 2 to 4 weeks. Like this one, A, the patient is A. What is your clinical diagnosis?
linear alba
linear alba ได้ค่ะแต่ต้องไปอยู่ท้ายๆเลยอันที่หนึ่งไม่ใช่ linear alba อัน linear alba usually we put 3 clinical diagnosis so linear alba is number 3. Okay, what is number 1 should be hyperplasia ไม่มีอยู่ในชื่อโรคค่ะ lichen planus อันดับ2 like oral lichenoid lesion อันดับ 1 เลขที่อะไรคะ2 เลขที่อะไรหนูตอบไลเคน26ได้นะไลเคนแต่ว่าไลคีนอยอันดับ 1เนาะแต่ถ้าเกิดเป็นกรณีเคสนี้ก็ขึ้น oral lichenoid หรือ oral lichen planus อันดับ 2 เป็นอันดับ 3 ค่อยเป็นนี่เหนียวบ้านจริงๆเอามาใส่ไปอย่างนั้นเองอันดับมีอันที่อยากใส่วันนี้อันดับ 2ดูปัสไม่เอาอยู่กรุ๊ปเดียวกันแล้วไลคีนอยดูปัสอยู่ในบรรทัดที่ 1เลยอันดับที่ 2อีกกลุ่ม
อันนี้คืออันแรกที่เป็น
เวลาเราได้แอดเขาจะขายแต่ถูกนะถูกที่พูด
ว่าอะไรนะมันก็ที่แบบ
Fictional keratosis.
แต่มันก็เหมือนกับ
เอาไล
มันเหมือนลีเนียว่า
ไม่ใช่ fictional keratosis ก็ได้ป่ะ
อีกก้อนนี้ขาวอ่ะ
fictional
อยู่ลอง
keratosis ไม่เอา
just
มันเป็นไป
try
ได้ป่ะ
เป็นอีกก้อน
เป็น
ขาว
ไปได้ป่ะ make sense fictional keratosis
อันดับหนึ่งเอาเล่าไลคีนอยนี่คือแบบดีที่สุดเลย แต่ว่าจะ slash lupus slash lichen planus อยู่ในกลุ่มเดียวกันกลุ่มอันที่สองควรจะเป็นอะไรคะ diagnosis
แล้ว fictional keratosis กับลีเนียว่าต่างกันไหม
I don't know
เรียนรู้อะไรอ่านสิ่งนี้
ไม่รู้อะไรเลย
ลงยูทูบ
เอาไว้
จริงปะ
พูดเลยว่า fictional keratosis
เดี๋ยวบ้านนักเรียนต้องไว้ท้ายๆเพราะว่ามันไม่ได้อยู่ใน
ไม่อยู่
ไม่รู้เหมือนแอปต้องเป็นสีขาว candidiasis ก็ได้นะแต่ก็ยังไม่ใช่โทนักเรียนเราอยู่ชั่วโมงอะไรลิวโคเพเคียเคสนี้อันที่หนึ่งคือออรัลไลคีนอยเพราะว่าเราเห็นมันอยู่ใกล้ๆอะมากัมเนาะแล้วก็มีไว้สไลเอชันอันนั้นอาจจะเป็นไลคีนอยเพราะฉะนั้นถ้าเราจะทรีตไลคีนอยเราก็ส่วนใหญ่มันมาจากการสัมผัสกับอะมากัมฟิลลิ่งใช่ไหมคะเราก็เปลี่ยนอะมากัมพอเปลี่ยนอะมากัมปุ๊บคนไข้หายคือลูกบีม Okay, so if we eliminate the cause and it has good response, therefore it's not leukopenia. It's lichenoid lesion in this case. If this case is not respond to the chain of feeling and the patch test also say no allergic to it, then we have to think that it may be leukopenia. And then we have to do a biopsy. Also, if in the first day we see the patient, if we cannot find any causes, then we have to perform a biopsy. Okay? And the biopsy, if it's come out to be SCC, lichen planus, so we manage according to that disease. In case that it will be leukopenia, it means that the histopathological result come out to beอะไรนะคะkeratosis หรือ dysplasia ในที่อะไรคะ
keratosis คำตอบคืออะไรนะ
keratosis หรือ dysplasia
Okay, so if the histopathologic result come out to be dysplasia or keratosis, then this lesion has definite diagnosis of leukopenia. Okay, so leukopenia is strictly the clinical term. Okay, if it's hyperkeratosis, we keep looking for the source of irritation and try to get rid of it. And then we may have to follow up for every 6 months. If it is dysplasia, then we should consider the total excision and we have to observe after that every 3 to 6 months and lifelong. Okay? So for the total excision is the discretion of clinician. So we have if the patient are quite old, female, quite large lesion, we recommend to total excision. If the lesion persists for several years, also recommend total excision. What about the size of the lesion? If it is the floor of the mouth, we recommend total excision because half of oral leukopenia in the floor of the mouth turn out to be dysplasia or carcinoma. Okay, compared to buccal mucosa or this area, buccal mucosa, it has only 16% to be dysplasia or squamous cell carcinoma. Okay, so if is the floor of the mouth is not okay. The clinical appearance, if it is homogeneous leukopenia, it has low percentage of malignant transformation. Compared to speckled leukopenia, it has about 18 to 47% of malignant if you have leukopenia,
I have.
which one you would like to have? If you have to have
แต่อันนี้คือโฮโมจีนัสใช่ไหม
โอเค เป็นกลิ่น homogeneous เนอะ so speckle is not good okay it's my chance so this is also have to think okay another type is multifocal in proliferative verrucous leukopenia this is also have a quite high percentage of malignant transformation what is the meaning of malignant transformation percentage of malignant transformation
change into cancer
Yeah, so it's been 100 patients with thin leukopenia today. And if we follow the patient for 5 years, only one patient develop cancer. But if it's speckle leukopenia, 47 develop cancer. Okay? And grading, dysplasia grading. The severe dysplasia have high percentage to develop cancer. But the problem is that even though there is no dysplasia, also have some percent, some proportion of patients develop cancer. Okay. So we recommend that even though it's come out to be hyperkeratosis, it should be a lifelong follow-up. Okay, that is finished. for leukopenia มีคำถามไหมคะ เดี๋ยวเราจะขึ้น erythropecia ซึ่งคล้ายกับลิวโคเลยไม่เหมือนกันนิดๆหน่อยๆถ้าเข้าใจคอนเซ็ปต์ก็จะง่ายมากเลย มีคำถามไหมคือทำความเข้าใจกับอันนั้นให้เสร็จก่อน แล้วเดี๋ยวอันเนี้ยก็เปลี่ยนนิดหน่อยก็รู้เรื่องเลย มีไหมคะ มีคำถามไหมไม่มี มีไหมคะ รู้เรื่องดีนะ ไม่มีตรงไหนถามนะ
feature อันนี้คืออะไรอะไม่รู้อะสักประเภทหนึ่ง
ไม่เร็วเกินไปนะ เมื่อกี้นี้คิดว่าชั่วโมงเดียวพูดเร็วหน่อยโอเคนะ Okay, so now we're talking about oral erythropecia. Similar to leukopenia, it's a clinical term for a red patch that cannot be characterized clinically or pathologically as other lesions or condition. So its exclusion criteria is less common than leukopenia, but it has greatest potential for malignant transformation among OPND, except for the proliferative verrucous leukopenia. I didn't talk about that because it's maybe quite difficult for you at the moment. So you can read by yourself. If you understand leukopenia, then you can understand proliferative verrucous leukopenia by yourself. Okay, so start with the exclusion of common red lesion, atrophic candidiasis, desquamative gingivitis, lichen planus, the erythematous form. This called lupus erythematosus, and also contact allergic reaction. This one is lichen planus. So you can see red area and some white striation associated with the red area. So this one is not difficult. The difficult one is desquamative gingivitis. So you can see it's very, it just shows as a white, a red gingiva. And maybe sometimes you cannot find any white striation in any area. So this one is very difficult to separate from erythropecia, but erythropecia not usually occur in the gingiva. Okay, this one is also not erythropecia, is chronic atrophic candidiasis. Okay, you can see a red area. This one corresponds to the outline of the denture. Okay, so this patient wear denture 24 hours a day. So no one know that he doesn't have teeth. Okay, so he wait all the times. And so when we remove the prosthesis, you can see there is a fungal infection present at a white lesion like this one. So this one is not erythropakia. So if it's not leukoplakia, we can eliminate the cause. So this case we think is candidal infection. So we have antifungal therapy for this patient and change the dentures, and then the mucosa come back to be normal. So this one is not erythropakia. Okay, so similar to leukoplakia, the etiology is related to tobacco usage, smoke or not smoke, better quit alcohol consumption, and also syphilis, but this one is tertiary syphilis, virus, and Candida albicans. Nowadays, patients who are immunocompromised, like AIDS, or patients who receive immunosuppressive treatment also have chance to develop oral carcinoma and also erythropakia. And clinical features, middle age to older adults, so about 40 years, you have to think of OPND. No significant gender predilection because this is not really related to smoke like in leukoplakia. The floor of the mouth, the tongue, and the soft palate are the common size. So you can see that we do not think of desquamatic gingivitis as erythropakia because it's not a typical location for erythropakia. Usually asymptomatic, and it's present as a well-demarcated red patch. When you palpate it, it's soft. And this one is erythropakia at the soft palate of 62 years old male. So you can see if you have a patient history, the patient do not report any trauma in this area. So we should think of erythropakia because the patient is quite old. Soft palate is quite a typical lesion, typical location for erythropakia. And this one, very red area at the buccal mucosa. So if it's this red, you have to take in a patient history. Maybe the patient have something like trauma or chemical injury. Histopathologic feature of oral erythropakia is maybe atrophic epithelium or dysplasia. Okay, so from this photo, this one is normal. Which one is atrophic? Which one is dysplasia?
Left one is atrophic.
อันไหนคะ
Left is
Left one is
atrophic.
atrophic epithelium. Okay, so right one. So this one is atrophic epithelium. How can you know? Can you give me some reason?
Epithelium is big.
So it's quite thin. Okay, เลขที่อะไรคะ24บอกดีๆนะ ไปแล้วก็ไปจบเป็นเลขที่อื่นถูกไหมso this one is dysplasia. Okay เกรดอะไร severe dysplasia. โอเคเวลาสอบต้องทำให้ได้ด้วย ที่สอง Okay, so when we see atrophic epithelium, you can see that the epithelium is quite thin. There is no rhetoric at all. Okay. Again, when the patient comes at the first visit, we have provisional diagnosis of erythropakia. Then we do a biopsy. The biopsy, if come out to be squamous cell carcinoma, that one is not erythropakia. If it is atrophic epithelium, if pathologists read as atrophic epithelium or dysplasia, then you will give a definite diagnosis of that lesion as erythroplakia. Okay? So erythroplakia is a clinical term. We use it in the clinic only. There is no histopathologic feature of erythroplakia. Similar to leukopenia, start to find the cause, and if we remove the cause, then it should be better, improved for within 2 to 4 weeks. If longer than that, is no, it doesn't mean that it suggests that it's not the cause. Okay? Similar to leukopenia. In erythroplakia, if it's severe dysplasia, we recommend total excision. Okay, so this is the fact about leukopenia and erythroplakia. So based on 30,000 cases, 3,000 come out to be leukopenia, and only 58 cases is erythroplakia. So leukopenia are much more prevalent than erythroplakia. But erythroplakia, more than 90% of erythroplakia come out to be dysplasia or squamous cell carcinoma. Okay? In contrast, in leukopenia, even though it's more common, but 80% of them come out to be keratosis. Okay? So if you have chance to be leukopenia or erythroplakia, you would like to have which one? เป็นอะไรดี เอาพูดชื่อคำแรกคำเดียวเพราะว่าจบมันเหมือนกันริวเนาะโอเค so in Thailand it's also the same statistic. We have more leukopenia than erythroplakia, but most of leukopenia come out to be keratosis, whereas more than half of erythroplakia come out to be dysplasia or squamous cell carcinoma. This is from 7,000 cases at Mahidol here, Faculty of Dentistry. And this is just a figure to that I have been described. Okay? จบด้วยความรวดเร็ว
Wait, that's so quick, she's done.
มีคำถามไหมคะ
Wait,